Welcome, everyone. Let's dive into a fascinating discussion about sinusitis and its Ayurvedic perspective, as seen at the Arya Ayurvedic Panchakarma Center. Sinusitis, or rhinosinusitis, is basically an inflammation of the sinuses, those air-filled cavities that help with pressure regulation and act like, shock absorbers in our skull.
Right, exactly. And it's interesting how conventional science explains that when the natural mucus drainage gets blocked, it leads to inflammation and a whole set of issues.
Absolutely. And not only that, sinusitis is typically caused by infections, but there are so many triggers like environmental pollution, allergens, and even structural changes in the nasal passages.
Yeah, I see. And it's not just the causes that are interesting. The categorization itself is detailed. Acute, recurrent, subacute, and chronic sinusitis, which helps in gauging intensity and treatment duration.
True. And what caught my attention is the anatomical breakdown. The four sinuses, frontal, ethmoid, maxillary, and sphenoid, each lead to different symptoms. For instance, maxillary sinusitis can even mimic a toothache.
Right, that's a neat observation. It's fascinating how symptoms vary. Blocked nose, thick nasal discharge, headache that worsens on tilting the head. These are all classic clues.
Yep, and then there's the approach from Ayurveda. It correlates sinusitis with conditions like Nasaroga and Siraroga, presenting it as Kaphaja Siraroga or Dushta Pradeshyaya. I mean, it's like an ancient system that ties the disease to imbalances in kapha and doshas.
I get that. Right, but I have to ask, don't you find it a bit challenging how the Ayurvedic explanations mix both physical symptoms and dosha theory? I mean, sometimes it seems a bit metaphorical compared to the straightforward conventional definitions.
That's a fair point. Yet I think the strength of the Ayurvedic approach is in its holistic view. They not only consider the nasal passage obstruction, but also the lifestyle factors, like excessive sleep, poor diet, even sleeping habits with too high or too low pillows.
Yeah, exactly. The treatment modalities are equally intriguing. Ayurveda outlines two main paths, Shodhana, which is purificatory, and Shamana, the palliative approach. And then there's the Rasayana aspect to boost immunity.
Precisely. And let's not forget the detailed process in Shodhana. They start with Amapachana, basically breaking down toxins with digestive stimulants, followed by nausea therapy, which uses medicinal drops via the nasal passage.
Right on, that's quite the process. I remember reading about the practical steps, like having the patient lie on a flat surface with head tilted back to instill the drops. Quite methodical, wouldn't you say?
Yes, indeed. And then there's the complementary aftercare like gargling with lukewarm salt water, known as gandusham, and even dhumapanam, which involves inhalation of medicated smoke.
Interesting stuff. It almost reminds me of a carefully choreographed dance, each step ensuring the removal of toxins and the restoration of balance in the body.
Exactly. It's like a systematic reset, very much focused on pacification of aggravated doshas. The treatment is so tailored, even mentioning the exact herbal formulations like Dashamulaka Tutrayam, Trikatuchornam, and so on.
Yeah, quite detailed. And what's compelling is the clinical evidence shared from their center. A 35-year-old patient with symptoms like headache, blocked nose, and reduced sense of smell showed dramatic improvements after following these protocols over about 14 days.
Right, and the clinical steps were pretty comprehensive. Internal medication, external procedures such as Udvarthanam and Mukha Abhyanga, and then post-operative care. I mean, it's like a full package deal.
Absolutely. However, I do wonder about the recurrence rates given that sinusitis is tough to completely cure. It seems Ayurveda emphasizes regular panchakarma and rasayana to keep recurrence at bay. Would you say that's a sustainable approach?
It does appear that way. The literature even suggests that while sinusitis can be a krushrasadya condition, difficult to cure completely, the approach drastically reduces symptoms without major side effects. Consistency in following the treatment seems key.
Yeah, consistency is everything. Plus, the lifestyle and dietary guidelines play an important role. They advise on warm, easily digestible foods, avoiding cold items, and even avoiding exposure to cold, moving air or smoke.
Exactly, and that holistic prescription extends to home remedies too, like ginger juice with honey or tulsi tea, along with simple yoga asanas such as Setubandhasanam and pranayama. It's all about nurturing the body's internal balance. You know?
Right, couldn't agree more. And when you consider complementary treatments like aromatherapy, using essential oils such as tea tree or eucalyptus, it adds another layer of care. It's really a multifaceted approach.
Indeed, it's multi-layered, with careful diagnostics, physical examinations, X-rays, CT scans, and then the integrative treatment. They even tie in principles from classical texts like Karaka Samhita and Susruta Samhita.
Definitely shows depth in both traditional wisdom and modern clinical practice. Speaking of diagnostics, the level of detail in examining the sinuses, like tenderness in the frontal, ethmoidal, and maxillary areas, really underscores the precision taken at this center.
Absolutely. And the case study shows that despite initial challenges, like blocked nasal passages during early nausea, the careful adjustments and massage techniques resulted in significant relief, even improving the sense of smell.
Yeah, that's pretty remarkable. It's also notable how they adjust treatment based on the individual's constitution, the prakruti, like in the 35-year-old patient with Pitta Kapha and Vata Kapha characteristics. It's a personalized touch that really brings out the strengths of Ayurvedic diagnosis.
Exactly. It's that personalized medicine aspect that sets Ayurveda apart. They also offer clear advice on post-treatment care, emphasizing continued use of specific tablets, decoctions, and daily nostril installations, ensuring that the benefits last.
Sustaining the results is critical indeed. And let's not overlook the preventive measures highlighted. Regular hand washing, avoiding allergens, staying away from smoke, and even keeping air conditioner filters clean. All steps that complement both conventional and Ayurvedic preventive strategies.
Right. Prevention is always better than cure. Integrating these everyday practices can help reduce the incidence and recurrence of sinusitis.
Absolutely. Every little bit helps. Overall, this holistic approach, combining meticulous diagnosis, personalized treatment, and lifestyle adjustments, offers a comprehensive solution to managing sinusitis. It's inspiring how traditional knowledge can complement modern insights.
Yes, and it's like weaving together threads from ancient wisdom and modern science to create a robust fabric of healthcare.
Perfectly said. Well, it appears that whether you're battling a sinus infection from seasonal changes or dealing with severe chronic issues, this integrative method might just be the balanced answer.
Indeed, continuous care, personalized approaches, and following the pathya, those dietary and lifestyle guidelines, play a pivotal role in recovery and long-term
absolutely.
wellness.
It's a testament to how comprehensive treatment can provide relief and reduce recurrence, even for conditions as persistent as sinusitis. Thanks for this engaging dive into the subject.
Thanks for the insightful exchange. There's so much to learn from both the traditional approach and modern clinical experience. Till next time, keep exploring, keep healing.